Well, welcome to another episode of Leading During Crisis. I'm Jonathan Otero, and I'm going to be having a special guest on this episode, which I'm really excited about. If you've been following the series, you're seeing that we're getting technology professionals from different industries to get their take on IT and how they're dealing with it, not only from a technology perspective, but also from a business perspective as well. And on this episode, I'm excited to have someone that is going to give it to us in a different perspective. Chris Collinge from Florida Department of Health. So let me just tell you a little bit about Chris and what he does. Chris is the Director of Information Technology for the Florida Department of Health in Orange County. The state has over 67 counties, and his office is located in Orlando, Florida. His team has developed innovative strategies for statewide IT projects, standardizations for mobile and tablet technologies that use their EHR system. Chris has recently received the Best Practice Award, so he's really somebody that can talk about these topics. Received it from the National Association of County and City Health Officials. His leadership in developing systems to support medication reconciliation, I said that word right, and clinical decision support has impacted patients across the state, has helped support the work of over 18,000 employees in the Florida Department of Health. That's a lot. I'm sure there's a couple of folks probably that his initiatives have helped, maybe some of your family members as well. Chris continues to work on behalf of his patients, the patients of the hospitals and Department of Health struggling with chronic conditions, finding innovative ways to improve their quality of life. Most recently, he led an effort to develop a system that allows the Orange County staff to visually monitor TB patients taking medications remotely. It's called Video Direct Observed Therapy, which is really cool. We're going to get into some of that, which is a process that was previously quite costly for the organization and often had a very negative impact on the patient's daily life. Chris states that that a big part of their success is due to management's commitment to hearing staff frustrations and concerns at every step they take, and that this approach has ultimately led to their most innovative solutions. So let me bring Chris in now. Chris, welcome to the show. How are you doing, sir?
Great to be here today. Thank you.
And thank you for being here, because I can't wait to get your perspective and your take. And I really want to start right there where we just left off, because the premise of this show, as you know, when we spoke offline and we were setting this up, the premise is with all this digital transformation, right? The IT, the department, the IT gals and guys now have a prominent seat at the table with their strategic initiatives and what they can implement and what they can suggest for the organization to be innovative and go forward. And there's just a lot of interesting things that's going on right now, but there's some folks that are not being able to be as creative, and they struggle with exactly what we just said on the introduction there. They struggle with management, being able to, listen to their needs and implement some of their approaches and techniques. So I'm very curious to hear, I'm sure that's a great place to start. How is it that your team and your department was able to break through in that way?
That is a great question, and that is an ever so much challenge for many, many, many different folks out there, even in the Department of Health, of trying to break that gap of, look, I have an idea, and trying to even break it over to the business need. You do run into a lot of situations where you do run into managers, mostly business managers, some health officers as well, that believe that they have the answer. But it's that communication between IT and that manager, health officer, or business manager to communicate effectively the technology that goes along with the process they're trying to accomplish. So for example, one of the things that you had mentioned, we talked about video direct observed therapy. That is a technology that if you are a technician, if I was to just say VDOT will just solve all our problems as far as being able to communicate with the TB patients, I'm not talking really in plain language. I'm kind of talking in IT, and I think that's part of the problem with us in IT is we talk technical and we lose our audience. So we have to relate things back to more of what they will understand and making it very plain. The buy-in comes from trust. It really does. It comes from the people that you are supporting, understanding that you understand the business model, and you're here to bring a technology to bridge that gap to make things happen more efficiently and more effectively. especially during this midst of COVID right now, that is even more important to make those things happen.
Interesting take. And so that is exactly what, and I appreciate you sharing that, because the like I said earlier, we have a bunch of folks in the IT community that are not just hurting, right, but they're struggling with having to innovate these. They have these ideas, right, and the IT department, we spoke about this just a little while ago, the IT department is also looking to foster that innovation. And so one of the things I think that's interesting that this is bringing is, while there is challenges, you mentioned COVID, and there's challenges that come with that, no doubt, there is also some opportunity, right? Because we're starting to see the talent that we already have on our teams. I have these conversations all the time with IT folks, and they're starting to say, hey, you know what? Let's talk to this guy. Let's bring this guy in on our call or on our Zoom meeting, because he has these great ideas. Can you help us implement those ideas with our fiber services? So I'm starting to meet these new folks that I never knew were part of the organization, because they're getting creative, they're thinking outside the box, and they're coming up with these new ideas. But I think, Chris, and I'm curious to know your take. So you have these new folks that are starting to look like stars on the organization. The other challenge that comes with that, though, while that's a positive, some of the challenges is, how do we keep those people in-house? Because now everyone's looking for top talent when it comes to IT, and the cream of the crop is starting to rise. How do we keep those folks with our organization?
That's a fantastic question. And I will tell you this, most people think, oh, we need to pay them enough money. Money is not the number one reason people leave an organization. It's like reason number 4, if I remember correctly, from my organizational behavior classes. One of the top reasons people stay in an organization because they feel like they're making a difference and they're contributing to a bigger cause. And one of the things that we do here, that I do as far as with my staff, is I keep them engaged, but I also keep them in an environment where they can have themselves, as far as in a rich learning environment. If there's something that they want to proceed and get into more, we want to nurture that growth because it's beneficial back to us. You don't want to ever take the approach that, well, if I send them through training, or if I give them, extra classes, then they're just going to get certified and learn more, and then they'll just leave me for more money. That's not necessarily true. People like their jobs a lot of times where they work, and there's a lot to say with the state government in being able to work. Well, this is probably a bad environment right now for COVID because we're not working 8 to 5, but typical job in government can be a little bit less stressful than the outside environment as far as working conditions. But when it comes down to it, the nurturing of your staff, giving them what they need. And for example, in my position, my job is to move roadblocks and give them what they need to accomplish the mission. That's really a lot of what I do. Of course, I do strategic planning, and so I plan things out, but that's what I do for my staff. I move things out of the way and I give them what they need.
Exactly. You don't want to be a roadblock, right? You want to foster that innovation and creativity, and that's going to ultimately help not only the IT department, but the whole organization, right? So I appreciate you saying that, because I know there's some people out there that are wondering, the people who watch this series and the people who've watched the previous episodes, that's kind of like the core of what they're watching for, right? How do we, how do I stand out, and how do I make these suggestions to my superior that makes sense, not only from the IT perspective, but also from the business perspective as well. So just staying out of the way and not being a roadblock is critical. So let me ask you this, from, Department of Health, right? We're talking about a health pandemic. This is a big issue here. So from the start of COVID to present day, what changes have you seen and experienced? Take me through what happened in March. How did that look for your organization, and where we are at today?
Wow. That's a loaded question.
Take it away.
In the 28 years I've worked in IT, and almost 24 years I've worked for the state of Florida, 23 years I've worked with DOH. I will tell you this, I've never encountered anything like this before in my entire life. And I know I'm not alone when I say this. I'm sure there's plenty of IT folks out there saying the same thing. If there is one, I'd like to meet them, please, because I want to know what they've done. So in that premise, it is ever so changing on a rapid basis. My priorities sometimes change on a weekly basis as far as what we need to accomplish. But let's back up, like you said, back to February, March timeframe. Getting the calls as far as that our numbers were going up in the state of Florida, Our cases were increasing. Our state governor was saying we need to shut down, we need to reduce services. In the process of reducing services, we reduced our services down to 25% and sent a lot of people packing, working from home, remotely working on computers from home, remotely using Citrix Workspace to connect into the remote desktop computers. It was incredibly challenging. It was not just challenging trying to get them out in the field. It was challenging trying to get all the equipment necessary to make it happen. All of a sudden, now I have to purchase all this extra computer equipment or find this computer equipment for them to use. Picking up desktops and moving it home, that doesn't make any sense. It's a last resort, and I'm sure some may have done it. But you need laptops, and you need to be able to support that infrastructure remotely, which means putting techs on phones remotely to work with the users so they can actually get done what they need to accomplish. It was a big challenge, and it's an ever-going challenge. Now, in my environment, that was the February, March timeframe. When we got to like April and May, we started coming back into the office more, and by the end of May, June timeframe, because we're Department of Health, we have to be in the office. We can't fight COVID remotely. We have to be in the office to provide services. The biggest challenge now is we are getting so many contractors coming on board. I kid you not when I tell you 3 weeks ago that I was initially told 50 people were coming on board. And then a week later, I was told another 100 were coming on board.
Wow.
And then as of recently, I was just told last week, another 30 are coming on board. And by the way, we need to have a facility completely wired by this week, by the end of this week, being told this Friday, completely wired with computers, with phones, ready to go. Now, this is becoming my norm.
Wow. I'm surprised that you don't have my gray hair.
No, it is a challenge. And if the frustration that is felt right now for myself is I'm pretty optimistic and a proactive thinker. I like to get ahead of things. And I know a lot of people out there have got to feel the same way, that it's almost like a rolling pin coming on you as far as trying to figure out, how can I get ahead of this stuff? How can I, how do we combat this stuff as far as all these new challenges now? And how do we stay safe and be able to perform the job duties and requirements that we need as far as to be successful? It is a huge challenge. And I will tell you this, in my situation, it's changing ever so much on a regular basis, because the requirements of what we need to do are changing all the time. The priorities, the directions, as far as in the healthcare situation, we are in a situation now that COVID is everywhere. We have now moved to a situation of just trying to mitigate small outbreaks. So if one person has been infected and a group is being infected in that area, we try to go mitigate that area, that hot spot, because we can't get on top of it all. It's everywhere.
Sure.
So with that, my priorities change as far as what I have to provide to them and different technologies I need to look at. One of the technologies I'm looking at right now is getting a third-party vendor to come in and help us with contact tracing that can do it electronically without us having to have a person on the phone all the time trying to find somebody. So and this is just new as of 2 weeks ago.
Right.
So you really have to think on your feet really quickly. You have to think on your feet as far as moving forward with this ever so changing environment that's going to be with us for quite some time.
Sure. I mean, I'm already mentally prepared for the rest of the year that's going to be with us and beyond. So, and you have to adjust. You have to be agile. And let me tell you that, Chris, that, as you know, that's the whole reason why I created this podcast series, right? Because we're wanting to share with these, the IT community, because we all have to pivot. We all have to change. And if we don't, we're going to get stuck behind. So we have to innovate, create, and be able to change with the times. Otherwise, forget it, because this is here to stay for a little while longer. So
Yes.
You mentioned something that was very interesting. We talked about, you hinted towards it in your answer, but let's talk to me about data security, right? Especially being in the healthcare industry, consumer health, financial information, things like that is paramount, I'm sure, in your field, right? And I've read, I'm sure you've heard stories, and you read all the stories with all the cybersecurity attacks. It was a big topic prior to COVID in our industry. And now it seems that they're taking advantage as well. All this digital data points, access points. We talked about people working from home remote and having company issued devices potentially, or their own device where they're VPN tunneling into the network. So there's a lot of risk there. Can you give some tips for some of the IT folks that are watching that can implement and hopefully improve what they may already be doing?
Oh, absolutely. Years and years ago, this health department went through a situation where we had a breach of 3,000 Social Security numbers from employees. To make a long story short, that required the FBI and IRS to be involved and had me testifying in federal court twice.
Wow.
So I am very much in tune when it comes to security and privacy and the aspect of protecting our client's data, because it does belong to the client. The client owns the data. When it comes down to as far as trying to encourage a secure fostering of a workplace, really what it comes down to for your users, because most of your breaches come internal, is education. Educating those users, having them learn what needs to be done. If they make a mistake, make sure that they're taking material and doing material that educates them on what they have done and the potential risk. Make sure they know what they're up against. A lot of people have this feeling like, well, you know, it's a medical record. Who's going to want a medical record? When on the black market, they go for a lot of money. They go for tons more money than a driver's license or a Social Security card. So when we think of it from the perspective, it's educating our staff that if you had money, you wouldn't leave money just laying out. You're going to put it in your wallet, you're going to put it in the bank, or you're going to secure it in a safe, right?
Right.
You need to treat our information like money and secure it properly. But it comes from so much education and getting people to understand that this stuff is money and secure wise, and we're safeguarding people's welfare. So we need to make sure that we are doing a good job at that. From a technology perspective is the other part, making sure you have secure VPNs, making sure the environment home is secure. We have a rule for 2 locking mechanism for any type of situation we're safeguarding any type of confidential information, paperwork or otherwise. Those need to be in place. HHS has some great paperwork as far as giving you the abilities to do what's called a risk assessment, to do your own personal risk assessment. There's a lot of resources out there to look at, but when it comes down to it, it really is the education of those users. Those users are your frontline people that are going to be susceptible to a breach. And hackers now are on 100% alert at the moment because they know we're in a pandemic. They know the chaos is there, and they are going to do everything in their power to grab any information they can get to make money off of.
Right.
So more than ever, you have to be aware of what's going on.
Yep. We've done a couple episodes already of this series, and I've asked that question to all the people who participated in a different way, you know, because every industry has their own kind of, you know, every business operates differently in the marketplace. But it's interesting how cybersecurity is prevalent in every industry, right? We had a gentleman on from the restaurant industry. We had one from, you know, higher ed, and you know, all these different access points that these cybersecurity hackers have access to now. It seems like the common thread, maybe you would agree with this, the common thread as we know it to be is our weakest link is our employees, right? And we have to just constantly keep educating them, not necessarily the IT team, because we know not to click on a link, right? If we get it from a stranger, we get that, right? But I think the other folks now who are working remote, who've never had to do that before, and they're using their own company issued device or they're using their own personal device, they leave their computer open, the spouse comes over, checks their Gmail account, they click on a link, and now they're still tied into the VPN. Now the intruder's in. So I think, would you agree that you know, employee education
Absolutely
is critical going forward, right?
That's a good majority of it. I mean, don't share your, you know, we always go by the don't share your passwords and you know, make sure you lock your computers, but it's so much more than that nowadays, because the hackers out there are really intelligent, and they will mimic things as far as saying your account has been locked out by your IT department. Click here to reset it, which takes you to a hacker page, which has you put your credentials in, and then does nothing. But now they have your credentials to log into the network.
Right.
They're very sophisticated, and that's one of many different things. Malware, any type of ransomware. I've had other health departments I've talked with in the nation that were hit by not once, twice, but 3 times in 1 year with ransomware.
Mm-hmm.
And the city had to pay. So
Wow.
this stuff is real. This can cost
Yeah.
you so much money. And it comes back to the one person that did something wrong because they were either not educated or didn't listen as far as what needed to be done. It comes
Wow.
back to education, education, more education.
Hey, real quick, Chris, before we move on, I want to touch on something. You're the only one that I've interviewed that has ever, and I think probably the only one I know in my personal life that has ever had to testify in federal court with a case that had the FBI and IRS involved. What was that like?
Oh, the worst year of my life.
Mm.
There is nothing like being called in on Christmas Day or 2 days after Christmas Day by your lawyer while you're on vacation at 4 o'clock in the afternoon saying the FBI and IRS are here to see you.
Mm.
And my response was like, I must have really messed something up for them both to be wanting to see me. To make a long story short,
Oh
which really
man.
turned me a complete shade of complete white was when they brought to me not 1, 2, but 3 different lists of social security numbers and names that were our client names in our health management system.
Mm.
That was having to go through and look them up to verify that they were actually our clients
Mm.
and how they got their information. Was a long, tedious process that lasted a good 9 months.
Mm.
The first time lasted 9 months,
Mm.
which involved me testifying in court against her name was Tanya Fox.
Mm.
Uh, Made headlines in the news many years ago,
Mm.
back in it was 2013.
Mm.
And then followed up just not even a couple of years ago with another person that was accomplice that did not plead guilty that I had to testify again, all over again, same type of case all over again.
Wow. Wow.
So
That's
it's
interesting.
real.
Yeah, that's I can only imagine what that's like. And like you said, when you got that phone call, you were probably calling your account like, "Hey man, did you mess up my taxes or something? What did you
Right.
write?"
Like when you're doing
Wow.
your taxes, like, no, don't do that wrong. They're watching.
Don't expense that one. Oh man. All right. So I appreciate you sharing that because I've never had to ask that question to somebody. So I was curious to know what that was like. So let me ask you this question. Now, I know I could see that your work you mentioned earlier, and I could see that you're at your office now. Department of Health doesn't, you gotta be at the office and you don't shut down. You can't shut down in a health pandemic when you're the Florida Department of Health, right? So
Correct.
but I know that we also mentioned that there are some workers that may be working from home in different ancillary departments, and the majority of companies are working from home. So I'm working from home. I'm here in my home office here, and so what do you think? I mean, I've read studies on LinkedIn and different sources that say that this is a trend that's going to stay now. A lot of
Mhm.
organizations are looking at that where it impacts the budget, right? I mean, we don't need a 15,000 square foot space. Maybe we can downsize to 2,000, save money on the rent because now we have all these people working from home. It's cheaper for us. So, do you see that as a trend, working from home now and
Oh,
moving forward? What do you see the future like?
absolutely. We're not going back.
Mm.
There's no way. We are now neck deep into this. Companies are figuring out as far as how they can make remote work more profitably for them and more efficiently, and even make their staff happier. And still, even what we're seeing in some aspects, more productivity from working from
Mm.
home because they don't have all the distractions in the office. We don't have all the social gatherings as far as talking with each other. Now that's important in a workroom environment, but so is getting the job done. And what we see as far as when we were teleworking, even in our own IT department, all of a sudden, like service tickets were getting done even quicker and things were being done more efficiently. And things that we had never even thought of that we could do remotely were being accomplished.
Mhm.
These things are being seen all over the world right now. And with that in place now, with people realizing going, we can do this. I don't see us ever going back from that.
Right.
It's so much more than just working space and keeping the lights on in a building. It's work environment. Remember what I said, the first thing that keeps a person in the job, their environment,
Mhm. Sure.
where they're working and who they're involved with, their ability to be flexible in a lifestyle.
Mhm.
If you have a child at home and you're working remotely, you're not paying daycare.
Right.
So those
Exactly.
things I don't see those things going back. I really don't. I see us being in for changes that are going to be positive and necessary for us to move into the future.
Interesting. So as we begin to wind down here, Chris, I'm curious to know, and I just want to say thank you too, because I'm sure that my information is somewhere in your database. Because listen, Florida Department of Health, and I've seen doctors in Orlando, right? So I'm sure that I'm somewhere in your database. So I appreciate you keeping my data protected. Thank you very much for that. I will ask you this. I'm curious to know, we spoke about a little bit, we started with the professional, business part of it. And then we talked a little bit about technologies and data securities and how we're doing that. So I want to kind of tie it together here as we wrap up. I'm curious to know, the person who's out there watching, who's in an organization, whatever type of organization it is, but the organization has maybe gone through furloughs, layoffs. Maybe they're friends. They've seen friends and family members that have gone through such a tough time, and now they're on unemployment. And they have, they know that they have a job to do, right? They're trying to keep the lights on, but at the same time, they're trying to make sure that they keep a competitive edge with their whatever field that they're in. And I understand that the Department of Health probably doesn't, you guys don't really have too much competition, but the majority of folks that are watching this series, their company does have some sort of competition. So can you give a tip on how we can foster innovation, right? Being able to have creative ideas and share those ideas with upper management, but at the same time, keep the lights on.
Sure.
Any thoughts on that?
So I'll equate it back to health because that is my most what I'm familiar with the most. When it comes down to it, it's talking with those leaders as far as what they're trying to accomplish and the best way we can accomplish it. It comes down to looking at the technology that fits the equation, but it really does come with sitting down with those that are in an executive level and asking them, this is the situation we're in. And even from a competitive edge for companies out there, it's looking at see what they're doing and then looking at see what you're doing and making sure that what you're doing is giving you that competitive edge with the data that you're gathering from it, whether it be from your sales, from your marketing, etc., to make sure that you are on track with the things that are going on. This COVID is hitting everybody. So the one thing to keep in mind is if your company is suffering, I can promise you this, everybody else is probably as well, because everyone's being affected by this. So the key is keeping forward, looking at these new technologies, making sure you engage your IT people and making sure IT people are engaging executive management, because if those things are not happening and the IT department, the CIO, the director doesn't have a clue of what the strategic plan of that agency is moving forward, you're not going to get what you need to accomplish the mission at hand. IT is a support function. And by meaning that, we need to support the business moving forward and being on that bleeding edge, which means still participating in conferences remotely, even though you can't be there in person, having memberships as far as with different groups like HIMSS, Gartner, et cetera, to be in contact with those experts that can help you get through those areas, especially now in a time, the communication with other members of the workforce, as far as other directors, as far as these companies like Gartner, HIMSS, and other entities are so critical, because somebody out there is doing something really awesome that can really help you get through this time of need. So those things have to be even more in the forefront than you ever have done before, because this stuff is just changing so rapidly. Yep. And I don't expect it to slow down really anytime soon. I expect us to even get more creative and more innovative as far as trying to combat this stuff and still have that competitive edge with everybody else.
Boy, if I had the hammer, I'd say you hit it right on the nail there. You hit it right on the head there. This was that was a great way to end the segment, because I tell you, I know for a fact 100% that there's a person out there that's watching right now that is struggling with that, and I hope they hear your words and I hope they implement it, because if not, we're just going to be stuck here. And like you said, I agree with you 100%. This ain't going anywhere. We're riding this out at least for the rest of the year. So, either we become modern in a modern world or we get left behind. So great saying that. I really appreciate you saying it. Awesome. Well, listen, Chris, I want to thank you very much for participating in this. Getting your take and your perspective on it fills a gap and a need for this show. And so I really am appreciative that you joined me on this one. I think that this episode is really going to open up some eyes for a few folks. But ultimately, what I really hope it does is add value to the IT community. And even if we have one person out there, God, I think we did our job. So I really appreciate it, Chris. Thank you very much for joining me.
My pleasure.
Awesome stuff. All right, guys, stay tuned. We're gonna have some other episodes coming up next with some cybersecurity experts, and we're really looking forward to hearing their take on it. So again, Chris, thank you very much, and we'll see you guys on the next episode. Take care.